Hey guys, so I'm on my way to work and I wanted to talk to you guys about something that I've experienced often working in the hospital, and most recently, maybe a few weeks ago, I experienced this. So I had a patient who was about my age, and I'm 40, and he came in and he told me, asked was it okay if his girlfriend stays the night, right? So most of the time when people stay the night in the hospital, it's to help their family members out, especially older family members that may have dementia and have a habit of like trying to get up out the bed, or they might be a little combative and like the family is reassuring to them. So those are the type of people that I'm used to staying at the hospital, and they also kind of help take the load off of us, because if it's a busy patient, or like I said, a patient with dementia that's trying to get out the bed constantly, the family will redirect them and not constantly keep calling us when we're trying to do and work with other patients, right? So like I said, he was about 40, and so he said to me, he was like, my girlfriend was with me at the other hospital because he was a transfer. Is it okay if she comes? So I'm like, yeah, okay, that's fine. So I already got from report that the girlfriend was really like flighty. They thought that she was under the influence of something. Also because the patient, his toxicology showed that he had some things in his system. So anyway, she comes to the hospital, and when I tell you, attitude for no reason. Miss, I don't know you. I didn't do nothing to you. None of that. Like, I'm here to take care of your boyfriend or your man. At one point, she left out the room, and when I went in to give him his meds, he was like, is she gone? I'm like, I don't know. I said, what happened? Did you make her mad? What happened? He said, did she see you? Yeah, she saw me. Why? Oh, man. So anyway, this lady she didn't say nothing to me every time I would come in his room. Like, it was just attitude the whole time. And I'm like, listen, in all actuality, I really don't care how you feel, miss. I'm here to take care of this man. I'm not here to cater to you, to make you feel secure or anything like that, because that's what it was given, like, you're real insecure. And so I come in and I'm doing my job for him or whatever, and like, she would get mad when I would turn the light on. Well, I gotta turn the light on to give this man his medication, and if you got a problem with it, you can really leave, miss, because you're not the patient and I'm not here for you. That's what I'm thinking to myself. I can't say these things. Even if I wanted to, I can't say these things because this is my job. I can't do it. But anyway, so I worked with this patient for 3 nights in a row. And for 3 nights in a row, this girl gave me attitude. Like, I did something to her. At one point, she stormed out the bathroom and almost bumped into me. And all I kept thinking to myself, like, Lord, I'm glad she ain't bumped into me, because I might have forgot I was at work. And then one night, she wasn't there yet. And he said to me, oh, yeah, she really feels some type of way about you. And I'm like, feel some type of way about me for what? For what? Because how I look? Because I have absolutely no interest in your man. I have my own man. I don't want your man. Even if I was single, I wouldn't want your man with all of the shit that I saw in his system. I wouldn't want your man. And I'm just like, she feels some type of way about me. And I said, well, listen, I don't have nothing to do with that. Apparently that's her own insecurities, and I left it as that, right? I had the patient for 3 days, and I ended up picking up an extra day, right? When I tell you that he had a Caucasian nurse, right, that night, and when I tell you where I was sitting was outside of their room. When I tell you the girlfriend came to the door 50 times, being super nice to me, asking me, oh, excuse me, do you think that you can get me some ice? Oh, excuse me, this is beeping. Excuse me, thank you. All because I wasn't his nurse. But when I was his nurse, you treated me like shit. Like I did something wrong to you, sis. Check this out. That is your man, and that is my patient. And all I'm here to do is my job. I don't want your man. I'm not here to make you feel insecure. My beautiful black woman, I'm not here to do none of that. Like, I'm just here to take care of my patient. You understand what I'm saying? You don't got to treat me no different because you feel some type of way about yourself. That's not on me. That's not on me. You understand what I'm saying? Like, yeah, And then for me not to have him one day, and then you straight, oh, thank you so much. Oh, can you do this? Can you do that? When I'm not his nurse, but when I'm his nurse trying to take care of him, it's a problem. For all that, take him home and you take care of him. Take him home and you take care of him, sis. Since can't nobody take care of this man that's sick because you insecure, take him home and take care of him yourself. Y'all gotta stop acting like that, y'all. And for real, you don't have to stay at the hospital. If you don't plan on helping and doing anything for the man while he's in the hospital, stay home. He don't need you there. He good. That's what we got nurses and techs for. He's good. I just had to get that off my chest because I've dealt with that like on a few occasions, and yeah, I had one patient girlfriend tell him when I left out the room, "You see your nurse?" I said, "You see your nurse?" "Yeah, he saw me, miss. You saw me too. I came in and introduced myself to y'all." That is crazy to me. I don't know what patients or their spouses expectations on physical appearances of nurses is supposed to be, but this ain't that. So just deal with it. I'm gonna take good care of your spouse and keep it moving. Just wanted to talk to you guys. How do you guys feel about that? I mean, I don't know. Is it just me? Because I know I can't be the only nurse that has ever experienced this. Ladies, chime in.